Morning everyone, my name is Giorgio Trombatore and I'm the country director for Project Hope here in Ukraine. I will, in the next 10 minutes, I will walk you through about regarding Project Hope activities here in Ukraine, the impact of our work, and what are also some of the lessons learned. I would start by saying that Project Hope has a wide presence here in the country, as you can see on this map, from the north, from Kharkiv to Kramatorsk, Dnipro, Zaporizhia, Kherson, and Odessa. We are concentrated all along the east. This is the reason why, since the initial attacks of the Russian Federation in 2022, the war has somehow shifted and now is concentrated mainly on this eastern line. The presence of Project Hope in this area is essential because we are assisting local communities that are somehow have difficult, where population have difficult access to clinics, and where the impact of the daily shelling and drone is even more serious than obviously in the rest of the countries. When we look at a reality like Kherson, we have office there, we are doing mobile clinics, we are serving population that have been cut out to access of medical health. The reason is because, following also the clashes here in Kherson, many people fled, and in the area, somehow the people that remained were mainly old people that didn't want to leave the area. So we at Project Hope started to coordinate with the local authority to try to, as much as possible, by providing mobile clinic, by assisting the local administration as well with distribution of humanitarian kits, trying to assist this heavily and very impacted town. Likewise, this applies to all the other field sites. I think everybody by now is aware that following the Russian invasion, one of the first impact was the destruction of many of services here in Ukraine. There was a massive as well migration of people outside the country. More than 10 million people left Ukraine, and the problem is that in the following the invasion in the last 2 years, unfortunately, I would say the chronicization of the war here in the east has impacted as well overall the economy in the country. When we look exactly at our impact for our work, we can see that we have supported more than 400 health facilities. As I said, initially we started with in the area of Kiev, Borodianka, Chernihiv, but then lately, with the shifting on the war, the facilities that we're mainly supporting are located in the areas that I showed before, from Kharkiv all the way here to Odessa. We've been working very closely with the Ministry of Health. I think this has been one of our main strengths, our relation with the government. We signed an MOU. Our daily contacts are happening in Kiev, the capital, but as well in all our office. Our team regularly meets with the local administration, at the oblast level, at the Hramada level. This is very essential, I would say. When we look at specifically at some of the intervention, I think it's worth to mention our services of ambulances. This is something that we have started about, I think, in the month of June of last year. Now we have 10 ambulances in several oblasts that are serving from the nearby front line by evacuating severely wounded people to nearby hospital. Then we are also providing incentivization staff. We have provided more than 500,000 consultations. This is a big achievement for us. We do have as well our protection services. This is, I would say that, very key because, this is one of the emerging problems that we are seeing here in Ukraine is about the impact psychosocially on the people of this, this continuous, I would say, like tension, war, and question mark about the future. We do have as well established about 36 MMU. These MMU are working in areas that were normally, like people have limited or non-access at all to health services. And I would also remind that from the beginning we have, we have provided about more than $10 million worth of medicine all over the oblast. There is also another type of activities that I would like to share, if you allow me just a couple of minutes, and is the activities that we are carrying out together with the government and other authorities using our private fundings. It's a very key work and is regarding rehabilitation and construction. We have been carrying out construction in the area nearby Kiev, in Borodyanka, of kindergarten. We have constructed a new clinic in Zahalsy. As well, here in Kharkiv, in the area of Izumi, we have constructed a new clinic. These are works that are carried out by our rehab team. We have a rehab team that is sitting here in Kiev and another one that is in Kharkiv. We are very proud about these activities because these are very long lasting, and obviously this is not just limited in Borodyanka and Kharkiv. We did as well in the area of Chernihiv, repairing from roof to hospitals to Kherson by changing windows and so on. I'm concerned about the time, so maybe I would like to resume some lesson learned. Well, I mean, I think it's one of the main lessons learned is about the localization, about having good local partners. I think we have been addressing that from the very beginning. Since 2 years ago, we had local partners that we have that are partnering with Project Hope and are carrying out key works. Like, for example, one of our local partners is very focused on WASH, and I think this is very key. Another things that we understood is about it's about learning exactly the local laws and if you want the protocols in order to be to have our activities being implemented. I think that this is something that especially in the beginning when we were putting up our MMU, it was very important for us to understand how we could operate the modalities in order to be just to support the administration here, not to duplicate, and as well not to work within according to the law, because there are very particular I would say very particular key laws that needs to be respected in order to be effective and at the same time working as per the law. The remaining, the remaining needs, I think one of the I would say one of the key aspect is the remaining basic healthcare needs here in the front line. I think this is something that goes without explanation, whereby the presence of belligerent acts of continuous war is more present. You have higher needs in terms of making sure of delivery of drugs, services, clinics that are operative, and this goes from a car that needs to be available in order to reach remote places, availability of medical staff on the spot. Another one is the, how they call it, the multidisciplinary rehabilitation approach from physical health, mental health, and psychosocial support and social integration. I think this is an approach that we want to see, up and running here in Ukraine, so that could give a cohesive, I would say, support and response to the need of the people. I think there was also a question that came out during this presentation was what was our approach in order to be more effective with the local authorities. I think that we had we could maybe answer that by saying, obviously, we've been very upfront from the very beginning. We have tried as much as possible to engage the local government in every step that we do. When, for example, we selected areas where to construct, to rehabilitate, we went first to the Ministry of Health. We went to the local authorities and we asked them to show to us a survey or an assessment that showed all the needed and gaps areas. Then we coordinate that as well with the cluster, with the local other organization, and that made us to select the best place where we wanted to invest and to rehabilitate. Not only that, I think another thing that helped us a lot to build a cohesive relation with the local authority was our continuous visit in the field. Every time we go in the field, we try to make at least 1 or 2 field missions per month. The first things we do, we go and visit local authorities, which is from a mayor to the director of an hospital, to a doctor in a clinic that is maybe located far away from the town. I think this continuous relation, this continuous will and wish to reach out and sit down with them has been, I would say, the key for our success in being felt accepted and in having, I think, tried to respond to the needs. There is no, kind of mystery that we also have a very good, a very strong communication department, and we try continuously, to tell through our media, either it's in Instagram or Facebook, or we publish in English, in Ukrainian, we disseminate our works. So I think the government and the local authorities and the other as well stakeholders, they have an easy access to what we do. We are very transparent. All the money we are spending is there. All the activities they are doing are there. They are taught even in the form of video in order for, to be even more accessible. And I think that has been the main key, I would say maybe success, our strategy of communication to be directly close to the people.